Welcome to the Healthy Aging Pod. I'm Kelly Yee. You can follow me on Instagram at Kelly Yee Yoga or subscribe to my YouTube channel at Avatar Yoga. In partnership with EPC Canada, we are excited to bring you our Healthy Aging webcast series.
Our guest today is Sylwia Kolasa, a researcher at Western Norway University of Applied Sciences. She specializes in space medicine and holds 3 master's degrees in physical therapy, audiology, and public health. As well, Sylvia is a PhD candidate researching various projects relating to hearing loss, balance, and mobility, cancer, and regeneration medicine. With her business partner, Nicolas Delgado, they strive to assist researchers to pursue their skills to materialize their ideas and knowledge into impactful solutions. Hello, Sylvia. How are you?
Thank you. Hello. I'm great. I'm doing great. And you?
I'm very well. Thank you. Well, thank you so much for joining us today. So today we're going to be discussing with Sylvia hearing loss, balance, and mobility. And I just want to first congratulate you on publishing your research findings on hearing loss, balance, and mobility in older adults. And with that, I was wondering if you can tell us briefly how you decided to study this topic.
Thank you so much. I have chosen this subject to study because I have an experience in the treatment of people with vestibular disorders, hearing impairment in all ages. As an audiologist and physiotherapist, I also earned 3 master degrees in physiotherapy, audiology, and public health. So my knowledge and experience from several different fields develop rehabilitation in audiology based on vestibular rehabilitation program and evaluate rehabilitation methods utilizing technology. And I know that the need to develop audiology rehabilitation and increase awareness of hearing impairment related balance problems is important in all levels of healthcare. So that's why I develop and spread awareness about impact hearing loss on balance and mobility in all ages through social media channels.
Excellent. So we'll get to, because you did bring up the vestibular rehabilitation, and we'll get to that later. So is there a direct correlation that you found to hearing loss and balance, and then hearing loss and mobility? So let's start with the hearing loss and balance.
Yes, so nowadays it's known that there is a link between hearing loss and balance, mobility, and increased risk of falls and fracture injuries in older adults. About 27% of population over the age of 70 have reduced hearing by 30 decibel. Recent studies show that for every 10 decibel decrease in hearing, there was a 40% higher risk of a self-reported fall in a group of older people. And moderate and higher hearing loss was associated with falls. So walking speed has also been found to be reduced in older adults with hearing loss. And in a systematic review, an independent relationship between hearing loss and balanced mobility in older adults was found. Our research shows a significant association between hearing loss and balance and mobility. The researchers suggest several links between hearing loss and balance and mobility, that the association may be due to concomitant pathology in the auditory and postural control system, that difficulties in hearing injustice and attentional and cognitive strain that impedes postural control, or that the association is due to behavioral factors such as with withdrawal, for example, we conclude that further investigations are needed to shed light on the mechanisms involving hearing loss and postural control.
So there were so many things that you had mentioned that I find very fascinating. So in your findings, you're definitely finding these links. And is it something? Was it very specific to hearing loss and balance separately, and then hearing loss and mobility like as a separate, or did you look at it as all in one?
Yes, we look at like the the
Oh,
balance and mobility as a one thing.
okay.
Yes. Mm-hmm.
Perfect. And you did mention, of course, hearing loss is correlated to falls. And was it slower walking speed?
Yes, that was walking speed. Yeah. Mm-hmm.
So, in your findings, did you
Mm-hmm.
find a difference between men and women?
Yes, we found that males had poor balance and mobility compared to females. We don't know the reason, but research shows that, for example, the role of the gradual decline of hormones production is related to the reduction in muscle mass, strength, and physical performance is more evident in men than in women, but this warrants further investigation.
Oh, that's interesting. Okay. I just thought it would be interesting. I mean, like you said, it does need further investigation because you know, men tend to have more muscle mass than
Mm-hmm.
women. So it's interesting that they tend to have, in the research that you found, is that they
Yes.
tend to have poor balance, more worse balance than women, which, yeah, we'll have to look into that a little further.
Mm-hmm.
So, with that, because you were exploring older adults and specifically people over 70, um, we know that aging can bring on other chronic conditions, or they could have other chronic conditions. And how can, living with chronic conditions such as like diabetes, or perhaps maybe it's heart disease, affect hearing loss? And then how does that affect balance? And then how does that affect mobility? So let's start with maybe how does that affect hearing loss?
Yes, so people with diabetes and cardiovascular disease had poor, obviously with hearing loss, had poor balance and mobility. Cardiovascular disease, diabetes, and hearing loss are highly prevalent among older adults. It has been suggested that cardiovascular disease and diabetes may result in hearing loss by causing reduced vascular supply to the cochlea and vestibular system.
Mm, okay.
Yes, so there's a very strong significance, between diabetes, cardiovascular disease, and balance and mobility.
Okay.
Mhm.
What are some of the effective methods to help minimize some of these hearing loss challenges that as we age? Um, some methods that maybe you had looked into.
Yes, we suggested that some aspects of balance problems, mobility, may be mitigated by hearing aids. People with hearing loss with swayed more while standing still, measured on a forced platform when not wearing a hearing aid, and even walking speed was reduced when they are not wearing a hearing aid. So, but the role of hearing aids used to use for balance variants further investigation. But also we suggest that moderate or rather hearing in pattern in older adults is associated with lower levels of physical activity. So balanced exercise programs have been found to be effective for several balance outcomes in older adults. In general, but we have not found studies investigating efficacy in older adults with hearing loss. So balance and postural control can be improved by different exercise modalities, for example, vestibular rehabilitation. Yeah, and we know that the physical activity reduces the risk of diabetes, cardiovascular disease, and high blood pressure that have an impact on hearing loss and balance.
So it's kind of an interesting thing, right? That, physical activity is very helpful. But then having hearing loss increases falls. So in your research, have you found like the hearing loss deters people from doing more physical activity because of that? And then hence resulting in more sedentary activity again, and it's a cumulative effect.
Yes, a lot of people with hearing loss don't want to use hearing aids. So so it means that their physical activity is much lower than with hearing aids because of the communication. And also we saw that people who wear hearing aids, they are more flexible and they have better balance than without. So we actually recommend do daily physical activity with hearing aids.
I find it fascinating that, that it's sort of this, a lot of people don't want to wear the hearing aid for whatever reason. I know that there's, right, like, and I know that there's stigmas, and then there's also, the technology is definitely improved, like it can be more discreet now in the hearing aids. But at the same time, I think it kind of goes with, it's difficult to feel that, there is sort of the condition that you're, then people might treat you differently, I guess, if you are wearing a hearing aid. So I guess it's something that culturally we need to kind of no longer stigmatize, and then people will be more willing to wear it. And
yes.
So one of the things you did bring up, which I had mentioned in the beginning, that we'll come back to, so I think this is a good time. You mentioned again vestibular rehabilitation. And so what is that? Can you define that for us?
Yes, so vestibular rehabilitation therapy is an exercise-based program primarily designed to reduce vertigo and dizziness and or imbalance and falls. For most people with a vestibular disorders, the deficit is permanent because the amount of restoration of vestibular function is very small. However, after vestibular system damage, people can feel better and function can be returned through compensation. This occurs because the brain learns to use other senses, for example, like vision and somatosensory, like body sense, to substitute for the deficit vestibular system. So yes, this exercise you can do at home. The main goal of the treatment is to get patient back to not only a functional lifestyle, but also back to working on their fullest potentials.
And is this therapy available sort of around the world, or is it relatively new?
Yes, this therapy, this vestibular rehabilitation therapy is very popular in the world. So, and also there's a lot of platforms which offers that kind of programs. So yes, these exercise you can do at home or with instructor.
And
But this method is very popular.
okay, great. And so in our previous discussion, you had also mentioned there's other therapies that, as we know with hearing loss, there's different exercises and exercise programs in addition to this vestibular rehabilitation therapy. You had mentioned that your findings had found like yoga also helps with. Now, was that specifically for hearing loss, or they're more the cognitive with the balance? So the physical part of the balance and the cognitive part.
Yes, actually, certain yoga poses can be helpful for different ailments like imbalance, dizziness, diabetes, cardiovascular disease, and also hearing loss. And vertigo, and also vestibular problems, and cognitive as well, because the yoga has amazing using amazing poses to in a different fields. Yeah, so yoga can be considered therapeutic when poses are adjusted to fit the unique needs of the practitioner. So some yoga classes are designed for special group with unique needs, as I said, such as the people with balance issues. For example, yoga is a potential treatment for patients suffering from balance disorders, as I said, vestibular, muscular, and neurological system. Obviously, consult your yoga instructor before starting an exercise practice, but still there is not enough studies about the influence of yoga on body balance and hearing loss in patients and healthy individuals. Yeah.
That's something we'll have to explore then.
Yes, of course. I totally agree with you.
Yeah. All right. Well, thank you for sharing that information. Can you help define presbycusis for the audience and tinnitus, just for those that don't know?
Yes, so presbycusis is disorder which is characterized by reduced hearing sensitivity and speech understanding in a noisy environment. And yes, it is related with aging. Yes, but if you want to know more, what is presbycusis, I wrote an article on my website. So yes, you can find more about this.
Great. I did read that myself, and I found it has great information in there. So yes, thank you for sharing that too. And tinnitus?
Tinnitus?
Yes.
Well, tinnitus, there's a kind of like sounds in your, like extra sounds in your ear that you can hear, like just sound in your ear. And the tinnitus, there's a lot of factors actually, and the reasons why people have tinnitus. It's because of their lifestyle, because of the, for example, like brain or ear injuries. So there's a lot of different factors. But yes, tinnitus, they are like extra sounds in our ears, yes, that we can hear, and they were very itchy and yeah.
Thank you.
So people would yeah. Okay.
No, thank you for explaining that. And so essentially, it sounds like if you do feel like something's going on with your hearing, you're hearing just extra noises, then definitely recommended to go get it checked out because
Mm-hmm.
yeah. All right. So you had brought up also balance training, and is there other? So you brought up balance training with the vestibular rehabilitation therapy, and then yoga. Is there other types of balance training that you found in your research that is of value, or is it just sort of balance training in general? Yoga is helpful.
Yes, also like balance training, because vestibular rehabilitation therapy is good for people with dizziness, with problem with the nervous system. Yes, but we recommend also a balance training. So the balance training refers to a type of training that focuses on the ability to maintain poor posture over the body's base of support. So balance training has been shown to be beneficial for improving dynamic joint stabilization, which is the ability of the body to stabilize or keep the joints in poor alignment during movement. So dynamic joint stabilization is critical to injury prevention and improving performance. So yes, we also recommend balance training.
Anything else that you want to add or to share with regards to your research findings?
Yes, for example, we also recommend practice like body awareness, because yeah, older people with hearing loss have to really more on other senses such as vision and somatosensorial. Yes, but body awareness is a combination of our proprioceptive and vestibular sensory systems. Our proprioceptive input is the unconscious awareness of sensations coming from our muscles and joints, telling where our body are moving and how. So our vestibular inputs in the sensory input that responds to the pull of gravity. So this form tells us about our head's position in relation to the surface on the earth, and coordination of movements that affect our equilibrium. Yeah.
I love that your research findings, it's a little biased for me because it's interesting how you and I have actually connected, and then all of a sudden you're telling me about your research findings, and it's so correlated to yoga.
Mm-hmm.
Yoga definitely helps, of course, as we know, with balance. It helps with, you know, if you do have experience hearing loss, which when you had said that it helps with hearing loss, I had no idea that that was the case. I know it does help with vertigo, or can help, and it definitely
Mm-hmm.
helps build body awareness, self-awareness. Like, that's a huge part of the yoga practice that
Mm-hmm.
people start to develop, whether they choose to or want to or not. It just, as over time, the more they practice, they start to realize that they're developing um, this awareness, this understanding a little bit of their body, sensing things. It's like their
Mm-hmm.
senses get heightened almost. And I can say that for myself. I had, the more I practiced, it was just sort of coming together. And as a teacher, I hear this a lot from my clients, and a lot of my clients are older, and so it's such a I think it's such a nice sort of, for me at least, this nice correlation between what you're studying in your
Mm-hmm.
research findings and how yoga actually is so helpful, regardless of whether because that wasn't your guys's main, right? Like, that wasn't part of your
Mm-hmm.
main research. I just
Yes.
love
Mm-hmm.
that what the exercises are quite similar to yoga practice in itself. Um,
Mm-hmm.
so yes, I love that. This is this has all come full circle.
Yes, yes. I think that we need more yoga practitioners, more yoga instructors, and body awareness instructors, because this is so important, because we are like a human being, so we also have awareness.
Yeah.
How to move, how to hear, how to, from different sensors. So body awareness and yoga can develop our skills. So I think, especially now in this time, so I think we need more yoga instructors and body awareness instructors. Yes.
Yes. Agreed. Well, I want to thank you so much for this. I was going to ask you specifically uh, one last question
Mm-hmm.
um, with relating to, you mentioned that you have a business partner as well. And do you want to sort of brief on that? Like you're looking at, you and your business partner are kind of looking at helping researchers, or, sort of be a career researcher, I guess you can say. Do you want to sort of talk sort of very briefly on that?
Yes. So together with my business partner, Nicolas Delgado, who is a leadership and business coach, we help successful researchers to take their professional skills to the next level, so they can materialize ideas and knowledge into for example, profitable and exciting solutions, while creating lasting and fulfilling impact. Yes, because I think as a researcher, we need that kind of an experts, like a leadership and business coach, to put us in a totally different level of science of our businesses as well, because we don't have knowledge actually how to create our business, how to work on our branding, personal branding, how to, for example, earn money, use our knowledge, for example. Yes, so that's why with my business partner we create that kind of platform that we help people to solve their problems and challenges as well.
Right. Well, I love that you guys are doing that. I mean, part of the reason why I even started this podcast is very similar as the reason I started seeing, you know, academics and researchers like yourself. You have so much knowledge and information that the public is not necessarily privy to. It
Mhm.
tends to go specifically to other academics and not necessarily to the public. And I think this is why I sort of created this platform, was to allow people to hear, findings and which being just research that's being explored um, at this time, by
Mhm.
professionals like yourself, and kind of give your you a voice, because like you said, there's not really a platform or a voice to be had, because you know you'll stay likely in the academic area, right? Like if you're doing
Mhm.
posters or talks, it would be likely for other academics. So
Mhm.
I love that you guys are putting that together.
Yes, and also we are focusing on communication, because there's a lack lack of communication between, for example, like scientists, and we help researchers how to manage group of people as well. Yes, so we working on that kind of field together. Mhm.
Well, thank you so much. And if ever there is anything that, I can help you and Nicholas with, we can always like figure out sort of partnering or anything like that. You're always welcome to reach out to me. This is such a pleasure, Sylvia. And I hope that you enjoy your vacation, because I know you're on vacation. And
Yes, I am.
we will be definitely in touch soon. I look forward to your next phases of your research. And yeah, thank you.
Thank you so much. Thank you. Thank you.